All right, we're going to talk about medial shear of the proximal tibia in order to make the knee congruent in the from a shear standpoint. Okay, so the way that we're going to set up for this technique is we're going to bring the involved side. It's going to be up in the side lying position. We're going to bring it back again, starting in a relative extended position for our assessment. The foam roll is going to go under the distal portion of the femur. Okay, a lot of people, when they think that, they like go way up here, and that is not going to give you a good block of the femur to mobilize the tibia. Okay, so you want to be as close to that joint line as you can. And then same thing with your manual contact. You want to be as close as you can. Roll your pelvis forward a little bit. You want the body to be in alignment here. And now I just want to check with the knee fully extended, is there a hard infill in shear? And there's not a hard infill here. In fact, it is a little loosey as we go there. So if I just want to check as I then go into, so I'm not worried about medial shear is what I'm saying, with the knee fully extended. Okay, that's not something I want to mobilize. As I bend her back, the knee goes off axis here, and I just kind of want to feel through range what feels like something. Is there anything there that is a hard infill that I want to mobilize? And right as I get to about this range, we're probably at, I don't know, lacking 25 degrees or so of knee extension. This is when it starts to go off axis. So now, since I'm working towards knee extension, I'm going to resist knee flexion. Okay, so don't let me straighten your knee out. Hold there. That okay? And let it go. And then I can also just kind of check, is there a rotatory component? And there's not. It's kind of more of the hard infill is more like locking into an ulnar deviation here for her. Right there, hold there, don't let me push you forward. And so my goal here would be to keep the tibia on axis and let it go and be able to get all the way to a relative terminal knee extension from a flexed position. And this is just the example that we happen to have on the table. A lot of people are going to have restrictions in extension that go off axis into flexion. Other people may have them in flexion and they get worse going into extension. The same can be true from the technique that I normally do right before this, which is the shear of the femur, medial to lateral shear of the femur. Same thing may be true. It could be going more towards extension or more towards flexion that the restriction shows itself. Okay, so this video specifically is medial shear of the proximal tibia in sideline.